I thank the gentleman for yielding. I listened carefully to the gentleman from New Jersey, and I'm glad he has concern about the nation going bankrupt, which makes me question why would you want to enact a policy that simply stamps on the accelerator towards bankruptcy. I know that earlier today, many people on your side of the aisle are waving around a Congressional Budget Office letter talking about, well, we're going to save money. We're somehow going to reduce the deficit through these policies. CBO is made up of great professionals, but they only estimate, or as we call it, score what's before them. And guess what? If you don't put before them the doc fix, they don't score it. Now, already the Speaker of the House has said there will be a doc fix, that physicians will not receive a 21% pay cut on Medicare reimbursements. The Speaker said that on the record. So the ranking member of the Budget Committee, Mr. Ryan of Wisconsin, asked the CBO, okay, well, the Speaker has said we're not going to have the 21% pay cut, and I will read from this letter. I trust it's already been entered into the record, but it's a letter dated March 19th from the Congressional Budget Office to the Honorable Paul Ryan, and I will read the operative language. Quote, you ask about the total budgetary impact of enacting the reconciliation proposal, the Senate passed health bill, and the Medicare Physicians Payment Reform Act. CBO estimates that enacting all three pieces of legislation would add, I emphasize the word add, $59 billion to budget deficits over the 2010-2019 period. So I have my own letter from the Congressional Budget Office, and frankly, this is, as the gentleman from Texas knows, it's just one of the many budgetary gimmicks that are being used here. And I'm sure that people's hearts are pure. I'm sure their minds are clear. But their accounting would make Bernie Madoff blush. We're talking about 10 years of revenues matched up against 6 years of program. Every single decade, does the Democratic majority intend on turning off this program for 4 years? After this year, then are you going to have your 21, 22, 23% pay cut for doctors under the Medicare system? You're claiming Medicare savings twice. On your revenue side, you're claiming $520 billion in Medicare cuts, $210 billion in new Medicare taxes, but this is double accounting. You can't have it both ways. Either that money is used for the solvency of the Medicare system, or it's being used for your new entitlement. That brings us to the Class Act, the new entitlement that you're putting into this program. 5 years of premium, $70 billion that you are taking out of your brand new entitlement to use to reduce the cost of this. So are you going to pay it back? Even the Democratic head of the Senate Budget Committee said, quote, this is a Ponzi scheme. This is the Democratic chairman of the Senate Budget Committee described this scheme as a Ponzi scheme. Raids on Social Security. $53 billion in new Social Security revenue to achieve the appearance of deficit cuts, but they're not really there. Are you saying that you're going to permanently take this money out of the Social Security Trust Fund and not replace it? I mean, again, you can't have it both ways. You can't say that I have a program that's going to reduce the deficit unless you own up to the fact that you're going to cut doctors' pay 21% in the Medicare system. You're going to create a new entitlement, yet you're not going to fund it. You're going to yet again raid the Social Security Fund and not replace that revenue. I mean, again, it's just not realistic. Oh, and the donut hole. The donut hole doesn't get scored until the next decade. It is totally unrealistic. Again, this is they're casting no aspersions on the Congressional Budget Office, but they score what's in front of them. I could go to the Congressional Budget Office and say, I want you to score the Hensarling Family Health Care Plan, and I want you to assume that I don't get sick for the next 10 years, and my wife and I are putting our children up for adoption. Can you give me the number? Well, one assumption is false, and the other assumption is totally unrealistic. So CBO will score what's before them. Now that the Speaker has said on the record there will be a doctor fix. You cannot count the 21% pay cut